Right, good evening, everybody, and welcome to September's meeting of CSMC. Just a bit of housekeeping before we get started. We're not expecting a fire alarm, so if it does go off, we'll leave the building by the nearest exits. Please ensure that you've got your mobile phones switched off. And I think we all know where the toilets are, so that should be easy enough to find if you find that nature calls. We have got some apologies for this evening. Councillor Fenton is being substituted by Councillor Orrell. Councillor Hook is being substituted by Councillor Daubney, and Councillor Baker has given her apologies. Now, Councillor Wan is here as her substitute, but as committee members will be well aware, I, as the chair of this committee, have challenged this on a number of occasions, not least when it was put forward at annual council that the Liberal Democrats would take a fifth member of this committee as a permanent position. I'd like to remind everybody that this committee is bound by proportionality, and the proportion at the council is that the Liberal Democrat group is 21 members out of 47, which equates to 45% of the council. If we were to have 5 committee members as Liberal Democrats out of 9, that would equate to 55% of this committee, and it would be a voting majority on the council's only statutory scrutiny committee. That is why the Labour group and myself as the chair of Customer and Corporate Services and Scrutiny Management has challenged that on a number of occasions. Now, the Greens took up a place on this committee, and that was on the understanding that they would be regular attendees of this committee. I have been written to by Councillor Baker in the last few days, who has made it clear that she does not expect to attend this committee on a regular basis, if at all. And so we are back de facto to the same position that we were in prior to annual council, with 5 sitting members of the Liberal Democrat group on this committee and 4 other members on this committee. Now, my view is that that is not lawful pertaining to the legislation as set out in various acts, and the most recent of which is the Local Government Act 2000, which sets out how scrutiny committees should operate. Now, I appreciate that independent legal advice has been sought by the council, and I have seen that independent legal advice, which is heavily caveated. It makes it very clear that it is an opinion, and it also makes clear in 2 places that the opinion that there is a distinction between an appointment and an allocation is not strictly within the spirit of the legislation, and indeed makes it clear that there is a counter view that permitting political groups to appoint non-group members to their allocated seats goes against the underlying purpose of the proportionality provisions. The reason why I think that this is really, really important is that we have to be seen to be doing the right thing. And we are here to look at the way that the council operates, to be constructive, critical friends, and to try to drive improvement in public services and be a voice for the people of the city. And I think that by, in my view, gerrymandering the committee membership, we give the impression of marking our own homework, we go against the spirit and the purpose of the legislation, and it puts me as the chair of this committee in a very difficult position, because I don't feel comfortable with continuing with what I consider to be an unlawful committee. I think I would like us to take a 5-minute adjournment now. I'd like us to find a constructive solution to this, because I don't want this to be something that we have to go over again and again and again. It is quite clear that there are more members of the Liberal Democrats sitting around this table than there should be by proportionality. So I'd like us to take an adjournment. I think we should have 5 minutes to discuss that, and then we can see where we can reach.
Chair, there's no need for any 5-minute break. The legal opinion that the council has got is quite clear, and I think we should continue the meeting as it is.
I'd like us to adjourn the meeting. Thank you. Thank you very much. Welcome back to this evening's meeting of Customer and Corporate Services. Apologies for the adjournment there. We've been discussing the makeup of this committee and the legal advice. The council has provided legal advice which is an opinion and which is heavily caveated, making it clear that there is contrary legal advice that permitting groups to appoint non-group members to their allocated seats goes against the underlying purpose of the proportionality provisions. As such, I, as this chair of this committee, do not feel that this meeting is lawful. I therefore don't feel comfortable to continue with this meeting as the chair of this committee and will be withdrawing. I would invite any other members who similarly feel that this is not appropriate to continue in this way to also withdraw, and will give my apologies for the remainder of this meeting.
Chair, I would just like to confirm that the legal advice provided during the adjournment is that full council is in receipt of independent legal advice. As far as I'm concerned, the seat is allocated to the Green Group. Councillor Baker has sent her apologies and asked for a substitute. And the position is that Councillor 1 is the approved substitute and that Councillor Baker is entitled to ask any member of the council to act as a substitute in her position. So I would just like to clarify that.
I'd just like to make it known that I feel similarly uncomfortable as Councillor Crawshaw and will also be withdrawing from the meeting, as I don't think that the public would have faith in the makeup of this committee and the spirit of the legislation. Thank you.
And I'd like to pass on my apologies too. I don't believe this meeting is lawfully constituted.
Members of this committee, the minimum quorum for this meeting to continue is 4 members. The Vice Chair has also sent his apologies today and is being substituted. In the absence of a Chair or Vice Chair, please could I seek a nomination for someone to chair this meeting?
Yeah, I'm having had no chairing training, I'm more than happy to chair as long as you can advise me.
Thank you. And is there a seconder to chair? Thank you. So please can I ask if everybody is content for the councillor to continue chairing this meeting?
Not content.
Okay, so that's 1 vote against. Is any in favour of?
Just for clarification, I'm saying.
Okay. Oh, right. You just said that you weren't content. Sorry. Anybody in favour? Noted the abstention, however, vote is in favour, so you're duly appointed as chair for the duration of this meeting.
Thanks, everybody. Well, that was unusual. I do think it's a shame that the Labour group don't want to hear about the public health update and the finance reports, etc., etc. However, let's crack on. Item 1, declarations of interest. Is everybody happy with the minutes? Item 2, sorry, the minutes. Councillor Dulby, can you put your mic on, sorry?
Right, Chair, can I just clarify? We have a number of substitutes present this evening. Those who can formally vote on the minutes are those who were present at the last meeting in order to confirm that the minutes were a true and accurate record. If we're unable to do that, or members feel uncomfortable, or we just don't have sufficient people to do that, they can be deferred to the next meeting. So the quorum for this committee to go ahead is a minimum of 4. No, but we'd need more than 1 person who was present at the last meeting to confirm they're a true and accurate record.
Just one quick comment. I did wonder whether Councillor Levine would actually chair the meeting. It's 6.
It was edited online, Chair, but it wasn't in time for the agenda, so it is correct online.
I'm
Thank you,
happy.
Chair.
Oh, sorry.
Thank you, Chair. Just a reminder, I am still present in this meeting. Can I register my abstention when it comes to voting in favour of the minutes of the last meeting, please?
Well, on the Monitor Officer's advice, I'm going to propose that we defer the minutes to the next meeting. If that's okay.
Can I register my abstention on that vote, please?
Item 3, public participation. Do we have any registered speakers? No public members. Item 4, the public health update with long COVID modelling. I think Sharon is here to speak to us.
Yes, thank you, Chair. Thank you for help with the presentation this evening. If we move on to the first slide, most members of the committee and members of the public watching will be very familiar with these charts now. We've been sharing this information throughout the pandemic. And as usual, the information I'm sharing with you this evening is the most recent data that we have available. So as you can see there, the validated rate, the official rate that's been validated nationally for COVID for York is a rate of 269.7, which represents 569 cases. Since these slides were produced, we've had more recent data. So today's figure which is a provisional figure at the moment. This is based on our local data. That rate has dropped to 236.5, which represents 499 cases. So as you can see on the graph there on the right, the red line being York, how our rate has been falling, and today's data shows that that falling trend is continuing. So our rate is below the regional and national rate at the moment. And as you can see on the left-hand side, the red bar being York, this is where York stands in relation to the other local authorities in the Yorkshire and Humber region. And as you can see, we have the lowest rate. So moving on to the next slide, this breaks that data down in a little more for us and shows the rate. The blue line is the rate for the various age groups, but also the number of cases. Because if we just look at the rate, it doesn't always give us a very accurate picture of the numbers. So as you can see there, the age groups that we're seeing the highest rate at the moment is in the 15 to 19 age group, 10 to 14, 15 to 19, and then the 40 to 44 age group. It's been quite consistent now over a number of weeks that we're seeing the highest numbers in the under 16s. And that is really because at the moment, children over 12, between 12 and 16 are not eligible for the vaccination. So we're seeing higher case rates in that age group. We do know that the government have announced that 12 to 15-year-olds who have underlying health conditions and compromised immune systems will be offered COVID vaccination, but we're still waiting for a final ruling from the government as to whether healthy 12 to 15-year-olds will be offered the vaccination. So on to the next slide, please. We always look quite carefully at what's happening with the infection rate in the over 60s. This is because we know that people over 60 are more likely to have underlying health conditions and therefore are more likely to require additional help from health and social care, for example. And as you can see on the graph there, there's been a bit of up and down really in terms of that over 60 rate. But as you saw in the previous slide, the numbers week to week aren't necessarily that high. The rate there was 81 cases, which was a little spike upwards. But today's data shows that that has fallen slightly. So I'm sure because the numbers are relatively small, we'll continue to see some variation week by week in terms of those numbers. On to the next slide, please. This gives us an indication of what's happening in terms of COVID symptoms in the population. So we get NHS 111 data. That together with case data helps us to understand what's actually happening with residents and the burden of disease amongst residents. Because these are people ringing NHS 111 with symptoms who haven't necessarily been tested yet. And as you can see, again, quite a lot of variation in that, going up and down. And again, I would expect to see that a very similar picture over the next weeks, particularly as schools and universities open, as we head into winter months. People will be ringing NHS 111 with respiratory symptoms that may or may not be due to COVID. So I would expect to see those numbers start to increase slightly. Next slide, please. This slide shows us what's happening with hospital admissions. So as you can see, since we had the very high peak of hospital admissions earlier in the year, those numbers dropped quite substantially. They did start to go up, but they have pretty much stabilized. And so we're not seeing a lot of hospital admissions at the moment due to COVID and very little activity in intensive care. It's worth noting with the hospital data that these are not necessarily all patients who have been admitted into hospital with COVID. They may have been admitted to hospital for some other reason, but because the hospital does routine testing, they may have been tested positive when they're in hospital. So it's important to understand that when looking at this data. So on to the next slide, please. This shows what's happening with deaths. The red line at the bottom is deaths due to COVID. And then you can see we also track all deaths since the start of the pandemic. And we also compare that with the average number of deaths that we would expect to see using the period 2015 to 19 as a comparator. You can see there that fortunately we are having very few deaths due to COVID, still seeing some, but very small numbers. And then when you look at the excess deaths, again, we're seeing 125 excess deaths at the moment. They won't all be deaths related to COVID. They are excess deaths over and above what we might have expected to see over that period. But fortunately, low numbers of COVID deaths. So on to the next slide, please. This gives you an overview of where we are with vaccination uptake in York. So overall, when you look at the over 16 population in York, 85.1% of the York population has had one dose of the vaccine. I'm sure that number will have increased today. It changes daily, but that's the most up-to-date figure we have. And 75.3% of over 16s have had both vaccinations. But as you can see, we have very high uptake, over 96-97% uptake in the older age groups. And obviously the 16 to 17-year-olds are playing catch up still because they've only recently been eligible for the vaccination. So the vaccination programme in York continues to be rolled out very successfully. On to the next slide, please. So this next section of the presentation talks a little bit about long COVID. This is something that the committee asked for at the last meeting. So there's quite a lot of detail in these slides, but I'll just pick out the highlights. So what we mean by long COVID is somebody who has ongoing symptoms of COVID. So there are three definitions of long COVID there. Acute COVID, where someone will have symptoms of up to 4 weeks duration. Ongoing symptomatic COVID, so these are medical definitions, where somebody has symptoms between 4 to 12 weeks. And then traditionally, what you will read about in the media about long COVID, we're usually talking about post-COVID-19 syndrome, which is symptoms beyond 12 weeks. It's important, I think, to recognise that some of the symptoms of long COVID are shared with other disorders, most typically ME. Again, if anyone is familiar with the symptoms of ME, suffer with ME themselves, or have friends and family that suffer with ME, you will certainly recognise some of the symptoms that I'll describe in a moment. So we're still learning about this, it's a fairly recent phenomenon. But the best guess at the moment, based on the data we have, is that approximately 10% of the population that have COVID will go on to have persistent symptoms over 4 weeks, and 1 to 2% over 1 week. A positive test for COVID or being very ill with COVID are not necessarily indicators that you will develop long COVID. So members of the committee will recall, I'm sure, that at the start of the pandemic, testing was not readily available. And people were diagnosed with COVID based on clinical history and clinical symptoms. So a positive test, and you don't need to have been in hospital. You may actually have had relatively mild symptoms of COVID, but can still go on to develop long COVID. We know that vaccination reduces the risk of long COVID. So even though the vaccination doesn't provide 100% protection against infection, we know that it does protect not only against serious illness and hospital admission, but it also helps prevent long COVID. So it's another very good reason to be vaccinated. And when we look at long COVID rates in children, it is possible for children to develop COVID, but the numbers are very small. So we're looking at around 1 in 20 children that will go on to have COVID. But that again may just be that extended period of up to 4 weeks. What we don't know yet, because further research is needed, is we don't really understand the risk factors. So we can't predict at the moment who is at risk of developing long COVID and who isn't. There aren't any effective diagnostic tests for long COVID at the moment, so the diagnosis is based on clinical history and presenting symptoms, and we're still learning on what treatments are most effective at managing long COVID as well. So on to the next slide, please. So the list on the right-hand side is in order of frequency, the symptoms that people will talk about when they have long COVID. And some of this information is actually collected from the Zoe app. So we have, Ian might correct me, I think it's over 4,000 people in York registered to use the COVID app. But this data is collated nationally on the symptoms that people report, as well as symptoms that people present to the NHS with. So in terms of numbers at the moment, which I know is something the committee particularly wanted to know about, so it's estimated, and I must say this is only an estimate, is that there are 970,000 people living with long COVID in the UK, and that's data up to the end of August. And if we use that national prevalence and apply it to our population in York, that would equate to about 3,000 people in York living with long COVID. And the NHS has now got clinics in place to deal with long COVID. GPs are able to refer people to that, to those clinics. And so when we look at the expected demand, predicted demand in the COVID clinics across Humber, Coast and Vale, they're looking at around 260 patients a week. Going on to the next slide then, this gives you some information about the services that are available and the patient pathway for long COVID. So there are 3 long COVID multidisciplinary team assessment services across North Yorkshire and York. So that includes York and Scarborough Hospital Trust. So there's a long COVID clinic at York Hospital, at Harrogate Hospital, and at the Friarage Hospital, which is in Northallerton. Patients are assessed by their GP. There's a validated screening tool that is used, that is recommended for use by NHS England, so that there is some consistency of assessment and approach across the NHS. And then there are a range of treatment options as described there. So for very complex cases, it's consultant-led care, but dependent on the presenting symptoms and the clinical assessment, patients may also be referred for occupational therapy, physiotherapy. They might be prescribed or signposted to psychological therapies, sleep support services, and a range of other services that you can see on the slide there. What I think is important for the committee to be aware of is that even though these services are offered by different providers, there is an integrated care offer and a patient pathway. So we're working as a system to ensure that all parts of the system are working together to ensure that people get access to the care that they need. Primary care then, bit of jargon there, the primary care DES. DES stands for Direct Enhanced Services, and basically it means that GP practices are able to sign up to an enhanced offer for their patients. And all of practices across North Yorkshire and York have opted to deliver the long COVID service, which is excellent. So it doesn't matter which GP you're registered with in York, you'll get the same service offer. And then for children, each integrated care system, so our integrated care system is Humber Coast and Vale, are required to have one paediatric assessment service. And so Humber Coast and Vale have received funding to support the setup of one service at the moment, which is delivered through Hull. Next slide, please. That's it. Okay. So I'm happy to take any questions, Chair.
Thank you ever so much, Sharon, for that comprehensive update. I propose that we take, given that how late we are, five minutes of questions, and then we have a 5-minute comfort break, and then we can get back to the other agenda items. Does that sound okay with everyone? Any questions? Councillor One.
Thank you, Chair. Just going back to the percentage of residents that have received the vaccine, are there still disparities amongst different council wards? I know going back in time, there was a worry that some of the more city centre wards were behind the outer wards. Is that still the case? It could have been the case that it had something to do with demographics and age groups.
So there is disparity across York. So we know that the rates aren't equal across the whole of York. What we know, though, from the work that we've done is that it's not that people can't access the vaccine, because a tremendous amount of work has gone in now to make sure that people are able to access the vaccine, including telephone calls to people who haven't presented yet to find out what support they need, and we can vaccinate at home if necessary. It's really down to choice. And so there is a situation where perhaps there are certain groups in the population who will not consent to vaccination for various reasons, either because they don't trust the vaccine, they're worried about side effects, they think that they don't want the vaccine for whatever reason. So that's why we're seeing variation now. I think our push really in partnership with GP practices has just been to make sure that everybody has the right information so that people are able to make an informed choice of whether they're vaccinated or not. And they're not reliant on what they've read on social media or what their friends have told them. We've been able to give them the right information, and then it's ultimately their choice.
Councillor Orrell.
Yes, thank you. Just looking again at vaccination rates, Councillor One mentioned, 16 to 17-year-olds haven't had a lot of time to get their vaccine. I assume that's the reason why that's still low. But 18 to 29-year-olds have had quite a long time, haven't they? Is there any, have you found any reasons why they?
I mean, when 18 and 19-year-olds first became eligible for vaccination, there was a big surge in people coming forward. That has slowed off. That has now slowed in York, and it's slowed nationally as well, in that we're seeing a trickle through. We're not seeing the large numbers that we had before. And that, I think, is down to that those young people choosing not to come forward to be vaccinated at the moment. So there is more work that we're doing with young people. There's work that we're doing with universities and colleges to try and get that message across around vaccination, and trying to make it as easy as possible for them to turn up. So, you know, being able to turn up without an appointment, for example. So that work is ongoing. I think young people tend to think they're invincible at that age, don't they? So it's kind of trying to help them to understand really that it's still important for them to be vaccinated. So that work is ongoing.
Thank you, Chair.
Councillor Ollier.
Thanks, Chair. As we get towards younger children as well, I guess, and there's a bit of debate in the moment about whether or not it's sensible to vaccinate younger than that age group, which I think is sort of 16 on this clock, isn't it, at the moment? Would the intent, do you think, there be to still sort of process them through the current sort of system that exists at the moment, or could it be done in schools, or?
Very good question. The JCVI, the Joint Committee for Vaccination and Immunisation, has advised the government that on purely health grounds, the view is that on balance, we shouldn't be offering vaccination to all healthy children, but the government will be looking at it in the round. We know how difficult it has been for children over the last year. We know how much schooling they've lost. We know about, how their social lives have been affected. So the government will be looking and taking advice from the chief medical officers and others around whether they will recommend that young people, 12 to 15-year-olds, are vaccinated. You're right, over 16s are already able to be vaccinated. So we have been preparing for the introduction of children's vaccinations if we need to offer that. The challenge, though, is going to be the capacity in the system to be able to do it. So we've got the seasonal flu vaccination programme that's been extended. That's also been extended to school-age children. So there's the school-based seasonal flu vaccination programme. There then is still a school-based programme to catch up for those children that may be a bit behind with their school boosters, for example. So there's that catch-up programme going on. There's the COVID booster vaccination programme going on. And then, we might also be vaccinating children in schools. So it will be the school nursing service and probably only the school nursing service, and also the mass vaccination centre that will be offering vaccination to children if the government decide that that's introduced. A lot of work for schools to organise things for children to be vaccinated. And there's no guarantee that the flu and the COVID will be given at the same time. So there's an awful lot to consider. So all of those plans are in place. It will be challenging, but we will deliver an effective vaccination programme in York. The system will come together to make sure that we deliver a really effective programme if that's what the government decides to do.
Thank you, Sharon. I think in the interest of time, I'm going to draw this item to a close. I propose that we break for a comfort break and reconvene no later than 22, if that's okay.
Seven, which I normally do. Please don't take that in any way other than I have another meeting to go to, and I do normally leave at 7. Thank you.
Thank you all and welcome back. We'll move straight on to agenda item 5, the 2021-22 Finance and Performance Monitor 1. I invite Debbie and Ian to come and speak to us. Thank you for coming.
Yes, I'll just do a brief introduction. So this is the first report of the year covering the latest finance and performance information, and it follows the main monitoring report that was presented to Executive last month, which highlighted the main forecast variations. We're continuing to see those pressures, particularly in social care, both in terms of demand for the service and the costs. And that combination of increased complexity, tired workforce, pressures within the NHS and community-based services is all contributing to that overall pressure in social care, which is the main reason for the forecast overspend for the council. I guess we'd also say that those issues are not unique to York, being seen in probably most other councils across the country. Work is ongoing to address these challenges, including a cross-council project to support adult social care teams. And that project's looking at balancing those kind of short-term costs with long-term savings plans and looking at ways we can actively look to reduce costs in a planned way to avoid making decisions that might have a detrimental impact in the future. So that's a bit about the main reason for the overspend and some of the work that's been done about it. Given the continued uncertainty, both in terms of the national and the local economy, I do feel it's essential and prudent that we carry on planning to mitigate some of those overspends and looking at our cost control strategies to bring that forecast expenditure down over the year. So we'll be looking to try and bring that back within budget. However, there is a chance we won't be able to bring that back within budget, so just need to be clear about that. And also, it is clearly a very serious situation. It's a significant forecast overspend, and I don't underestimate the amount of work that's going to be needed to bring that back somewhere close within budget. The summary positions outlined in table 1, paragraph 17. And I would just also point out the detailed analysis for finance and performance was included in the original executive report, so we've not repeated all that here. And apologies, as I had inadvertently left a reference in the report in paragraph 21, where we refer to, sorry, should the mitigation outlined in Annex 1 not deliver, that referred to Annex 1 of the executive report. Sorry, I should have made that a bit clearer. So I don't know whether you wanted to say anything.
Thank you, Chair. Just very quickly, on terms of the performance, paragraph 27 downwards, mixed picture in the authority, really on performance. Debbie's talked actually, hasn't it, about the financial pressures and some of the human pressures that we're under at the moment. There are some really positive bits of news around sickness in the workforce, and we've just had a conversation about long COVID, okay, and having a think about how it might affect our own workforce going forward. There's certainly some challenges around dealing with customers in a timely fashion, some other areas, but internally within the council, a number of mitigations are in place. Make the point that some of this data is Q1 data, so actually we've had some very positive performance last year as an outturn, and so I'd hope that we can do things slightly differently in some areas, and that performance will come back on track within Q2 and Q3. Okay, thank you.
Thank you both very much. Have we got any questions? Councillor Orrell.
Yeah, I may have missed it in the report, Debbie. Is it possible to work out how much COVID has cost us in relation to the government grants that we've got? What's the gap between the government grants that we've received and what we've had to spend on COVID?
Yeah, I don't have that to hand. I think I put that in the outturn report last year, so I'll have to hunt that out. I don't want to guess because I can't remember off the top of my head.
I assume it'll be changing all the time anyway.
Yeah.
So
yeah, I'll email separately about that. That's okay.
Any other questions whilst people are thinking? I was just going to ask very roughly which council departments are doing sort of well on budget and which council departments are doing less well on budgets, and do you have that kind of disaggregate information?
Yeah, that was reported in the executive. I think it's the main overspends are within the People Directorate, within adults and children's. There are pressures everywhere. Every council service and department has been impacted by COVID and has got pressures. In pretty much every other directorate, they are being managed and they've found other ways to mitigate that. Within the People Directorate, they've not yet been able to mitigate that. And like I say, the combination of increased complexity, increased cost, the impacts of long COVID, mental health referrals, all those things have all contributed, alongside the challenging position of our health partners, has brought that. So every council is under pressure, every service is under pressure, but they're being mitigated, except for adults and children's.
That's interesting. Thank you very much. Any further questions? No. Well, thank you ever so much for coming along. Thank you for waiting. I'll move us on to the next agenda item, which is agenda item 6. The update on the monitoring and tracking of approved council motions, and I believe Janie is going to speak.
Thank you, Chair. This follows as a very, very brief report that's presented this evening for members to consider, but this is on the back of a report brought to this committee on the 10th of May 2021, when the committee asked for an update as to what happens in respect of council motions and how scrutiny can be kept informed of progress once full council had approved the same. The May report also included details of how this committee undertakes the monitoring of agreed scrutiny recommendations by the executive as well. And there's a much more formal process, as the May report indicated, in respect of that, in that there is a 6-monthly monitoring of progress of recommendations given to the executive, and how what the feedback is and what, if any, there is a future role in scrutiny. The proposal in May was that in respect of the council motions, where there's a more informal process, in that council motions are monitored by members of CMT, they're allocated a chief officer for oversight, and there's discussions that take place with members of the executive where necessary, is that the situation and proposal from May is that perhaps there's a 6-monthly update being brought, which sits in a sort of align with the monitoring of scrutiny recommendations, so that you get one combined report that deals with the full council motions and the scrutiny recommendations from monitoring of executive. So therefore, I think the decision in May was that we would have a 6-monthly update, and we're just not at the 6-month update as yet. So I think it's with the committee's indulgence, I think if we can bring a report to a future meeting of this committee, which has the details in respect of scrutiny recommendations and the full council motions as well, so that we can do one comprehensive report on behalf of scrutiny, and then we can perhaps have a bit of a more meaningful debate about it at that particular time. In May 2021, the motions from October 2018 up until probably April 2021 were included, but I have not brought the updating motions since that time because it's just a little premature, Chair. But I'm very happy to bring a more detailed combined report to a future meeting.
Thanks, Jenny. Yeah, I'm more than happy to take that recommendation, and I think we're looking at the work plan later on in the agenda, so we can possibly find a slot for it there.
Thank you.
Yeah. Is everyone else happy to? Excellent. Agenda item 7 is next, the schedule of petitions, and again, I think that's you, Janie.
Oh, it is. I think this will be very short because I'm afraid that my knowledge around what happened in 2014 and petitions is currently not in my head, because it's in my colleague Miss Steele's head, and unfortunately she's not in work at the moment. However, there was pre-COVID much more routine reporting of petitions to this committee, and therefore it's proposed that we do sort of bring back some reporting on petitions. Petitions are very important for council. They are brought to full council, and the full council procedure rules indicate that they should be referred, petitions should be referred to this committee for consideration. So therefore this is something that we want to rectify. The Audit and Governance Committee is going to be asked as part of its review of the Constitution to formally include the petition scheme within the Constitution so that members of the public are aware of what the process is around a petition, and it helps us be more transparent and with our procedures. So therefore, do propose to perhaps bring on a more regular basis feedback and monitoring of petitions going forward. I'm not currently able just to give a time frame on that, but I'm very happy for this to be included in the work plan for a future meeting, because I do think that this is important, that members of the public are aware of what happens to their petitions and the progress against them.
Thank you, Janie. Yeah, have you got a question there, Councillor Holly?
Do.
Excellent.
The report says we asked to consider the petitions we received and then agree an appropriate course of action, which I'm happy to propose if that's what we should be doing, that we, I guess, consider the action agreed column as the outcome. They all seem sensible to me. If that's what you're looking for in the report, I guess.
Thank you, Chair. Yes, I am, but I haven't got all of the details of all of the petitions here this evening as well. So if there's any queries that you raise from these or the actions taken, I'm quite happy to take those back and report to the committee if there's something which you feel needs more clarity or further details. I'm very happy to do that.
Yeah, I'm more than happy to go with that proposal. Yeah. Is everyone else happy? Okay, thank you, everybody. Moving on to the next agenda item, it's the work plan. So we possibly find a slot for those two pieces. Does anyone have any comments, suggestions, ideas for the work plan?
Chair, if I may, in respect of the motions report that you've just heard, it was 6 months, so that would be sometime sort of October, November, to feature again on the committee's programme, so that we can honour the 6 monthly commitment that we've given. So that would make it around October, November.
Yeah, Councillor Hollier.
From what I can see, the other CSMCs tend to have 4 items and the one in November has 3, so would that be a sensible slot? I think it's the 1st of November.
Mm-hmm.
Yeah, more than happy to go ahead with that. And do we need this petitions thing on the agenda as well? On the work plan, sorry.
If you wish, I can bring it. I can bring it at the same time. We've got a full council in October, as all members are aware. I'm not aware if there's going to be any petitions raised at that, because it's a little bit too early to know that. So November meeting, we could include any information that we receive in October if we do.
Councillor Holly.
Councillor Wan has correctly pointed out that there's nothing on the agenda for the CSMC in November at the moment. I've misread the North for October. So.
Very good. Well, let's definitely put those 2 items in there then. Robert.
Chair, there was also the request for the annual complaints report to be brought to next month's meeting.
Sorry, Robert, the annual what, sorry?
The annual complaints report.
So, Chair, if I may, the annual complaints report is a report that we are legally required to provide to Corporate Scrutiny Committee. And this report details the feedback that we have from the local government ombudsman and other regulators, our FOI, EIR position, etc. And any sort of recommendations that come out from the regulators in respect of our information governance. So it is a formal report that we are required to bring to scrutiny for their information, and obviously for members of the public to ask questions on.
Yeah, okie dokie. Councillor Dobby, is that a question? No, sorry. Yeah, I'm more than happy for that to go in where it needs to. Have we got a suggested date?
October? Oh, it's October, Chair.
October, okay. Yeah, let's put that there. So is there any further points on the work plan? In that case, I think it's any other business, and I don't believe there are any. In which case
There's no other business, Chair.
thank you. In which case I think I declare the meeting closed. Thank you ever so much, everybody, for attending.
Thank you, Chair.